Angie with News OK. When you come to the doctor's office for a bug bite that just won't go away, you might be surprised to find out it could be a staph infection. Well, we're speaking with one local doctor who will tell you how to tell the difference.
The biggest thing to be concerned about is if it's not really a bug bite. Sometimes people can think that they have an insect bite, in particular a spider bite, and it's really something more serious, or a staph infection. Staph's a bacteria that lives in our noses and on our skin, and sometimes if you get a little nick or a prick in your skin and you scratch it, or somebody sneezes on it or something like that, it can actually develop into an infection. A staph infection will be associated with redness, swelling, fever, and be very painful. And you may even have blood or pus coming out of the middle of it. Whereas an insect bite may be just itchy and maybe swollen, but shouldn't be as painful and may look quite different. You may start with a mosquito bite, but because you've scratched it with those dirty fingernails, it can turn into a staph infection. Things that you can do to prevent a mosquito bite, for example, in small children, a lot of people want to know what can they do to keep their kid from getting insect bites. Keeping your child with long pants or long shirts, and again, that's going to be difficult in the summertime. Or it is safe to use products that contain DEET in children that are more than 2 months old, but in a little baby you want to make sure you spray it on your hands first and actually physically rub it on, and just avoid their hands and face. If you have what you think is just a mosquito bite and it's getting bigger than you thought, well, try some over-the-counter cortisone cream, try your Benadryl, and see if it goes down with that. If it becomes more painful, or if it starts getting redder and larger, or you develop the fevers, then you definitely need to call your doctor. The most important thing to do to avoid getting a staph infection is to just practice good hygiene, keeping your hands washed, and actually clipping your fingernails, keeping them nice and short, because it serves as a nice breeding ground for the bacteria underneath your nails. Staph is treated based on how severe it is. If it's a minor infection and you catch it early, you can actually treat it with just warm compresses and warm soaks, like in a warm water bath, and possibly an over-the-counter antibiotic. But if it gets a lot more severe, then you need to see your doctor, and your physician may actually prescribe you oral antibiotic, and may even need to do a procedure that I call incision and drainage. And that's where you actually express a small amount of the bacteria out of the lesion. If you don't treat a staph infection and it becomes more serious, then you could actually wind up with an infection that gets deeper than just the skin. It could go into your bone or into your blood, and you could actually wind up needing to be hospitalized. So it really is important to contact your physician if you think you have one of these infections. If you think that your small child or your teenager may have one of these infections, I'd be happy to take a look and treat your child. You can go to my website at www.okcclinic.com.